Back in 2006, I wrote a book in which I listed the 12 medical truths we all need to know in order to survive. I call them Coleman's laws, and the 8th law in the list seems particularly appropriate today, since governments have taken advantage of a health issue to make decisions which have altered our lives in every conceivable way, and in ways which will affect the lives of generations to come. The health issue is, of course, COVID-19. Coleman's 8th law is this: the medical establishment will always take decisions on health matters which benefit industry, government and the medical profession rather than patients. And the government will always take decisions on health matters which benefit the state rather than individual patients. What you read, hear or see about medicine and health matters will have more to do with the requirements of the pharmaceutical industry and the government than the genuine needs of patients. That's the end of the quote. That's been never truer than it is today. Your chances of getting the best treatment for your condition now depend not upon your needs, but upon a system which has been deranged, distorted and discombobulated by a politically inspired obsession with a disease which doctors now know is no more deadly than the flu. And yet the government and the medical establishment has lied and lied again. They misled the public about the risk. They introduced house arrest and social distancing, which they knew were unnecessary because the danger of the bug had already been downgraded. They lied about the number of deaths caused by the disease, and they did very little testing so that no one could see that the virus wasn't anywhere near as dangerous as they said it was. And they stopped doing postmortems on those who died, so no one could see exactly what was happening. Because all our healthcare resources have been misdirected, people with suspected cancer have had to wait months for essential investigations and months for treatment. There's something uncivilized and inhuman about a health system in which patients with suspected cancer must wait and wait to be diagnosed and then wait and wait to be treated, hoping that they won't die while they're on one of the waiting lists. There are now well over 2 million people in the UK alone waiting for investigations and treatments for cancer. And within a few months there'll be over 10 million people on hospital waiting lists. In any state-run health service, financial resources must be finite. Not everyone can get everything they want. But the way patients are chosen for treatment is appallingly cruel and quite indefensible. And yet, people have been standing on their doorsteps, clapping the NHS, and NHS staff have been bowing their heads modestly, lapping up the appreciation and the applause as though they deserved it. And many of the medical staff probably believed that they deserved the plaudits because they haven't been told the truth, or they haven't found the truth for themselves. This is not a new problem. A while ago, I was invited to speak at a conference in London. The conference was, I was told, intended to tackle the subject of medication errors and adverse reactions to prescribed drugs. Goody, I thought. Iatrogenesis, doctor-induced disease, is something of a speciality of mine. I've written numerous books and articles on the subject, and my books questioning medical procedures have sold millions of copies around the world. My campaigns have resulted in more drugs being banned or controlled than anyone else's, and as a result I've been lied about more than anyone else. In addition to my speaking at the conference, the organisers wanted me to help them decide on the final programme. I thought the conference was an important one and would give me a good opportunity to tell NHS medical staff and administrators and nurses the truth. I signed a contract as a consultant and as a speaker for the conference. Here's part of the blurb promoting the conference. Against a background of increasing media coverage into the number of UK patients who are either becoming ill or dying due to adverse reactions to medication, our conference aims to explain the current strategies to avoid adverse drug reactions and what can be done to educate patients. That's the killer, the last little bit. What can be done to educate patients? Putting the blame on patients for problems caused by prescription drugs was brilliant. Most drug-related problems are caused by the stupidity of doctors, not the ignorance of patients. If the aim is to educate patients on how to best avoid prescription drug problems, the advice would be simple: don't trust doctors. The promotion for the conference claimed that it's estimated that errors in medication account for 4% of hospital bed capacity. And it was also claimed that prescription drug problems reportedly kill up to 10,000 people in the UK. As I would have shown had I not been subsequently banned from the conference, these figures are absurdly low. When a programme for the event appeared, eventually my name was not on the list of speakers. I was banned. The list of speakers did, however, include one representing the Association of the British Pharmaceutical Industry and another representing the Medicines and Healthcare Products Regulatory Agency. Delegates representing the NHS were expected to pay £250 plus VAT to attend the event, the fees to be paid by the NHS, of course. So why was I banned from the conference? The organisers said I was too controversial to speak. Why might that be? The drug industry? Is the drug industry now deciding whom they will allow to speak to doctors and NHS staff on the problems caused by prescription drugs? Do NHS bosses know that people attending such conferences will only hear speakers approved by the drug industry, and that speakers telling the truth will be banned? The scary bottom line is that the NHS paid a lot of money to send delegates to a conference where someone representing the drug industry spoke to them on drug safety, but where I was banned. The truth was uninvited. Doctors exist only for two reasons: to look after people who've acquired a disease and to prevent healthy people from falling ill. That's it. The rest is unimportant. But today's medical profession has been bribed by drug companies, bullied by and overwhelmed by bureaucrats and social workers, and forced by politicians to abandon most of their ethical principles, including, for example, the traditional principle of confidentiality. Through the weakness of their leaders in the medical establishment, doctors have been turned into ethically impoverished mercenaries. Principles should be indigestible, but the modern medical profession has swallowed its principles without hesitation or regret. It's perhaps hardly surprising that, very sadly, huge numbers of doctors now hate their jobs and regard them as merely a way of making money. Most doctors would prefer to do something else for a living if they could find something as lucrative. Vocation has been abandoned and replaced by expediency. Most doctors work the sort of hours that used to be worked by librarians. Medicine used to be a proud and independent profession. Sadly, much of the medical profession today is little more than a marketing arm for the pharmaceutical industry and a snitch service for the government. And things are likely to get worse rather than better. The power of the government and of large corporations is these days so great that you can't believe anything you see, hear or read on medical matters which is published or broadcast by a mainstream publisher or broadcaster. I wrote that last paragraph in 2006, but it's truer now than it was then. Today the mainstream media has been bought lock, stock and printing press. To look after your health properly and to reduce your chances of needing a doctor, you need access to information which you can trust. But that's not easy. Much of the medical information in magazines or newspapers or on network television and radio has been reprinted directly from press releases produced by drug companies or written by journalists who know far less about healthcare than you do. Very few publications, radio stations or TV stations have on their staff anyone capable of interpreting a clinical trial properly or of reading a scientific paper and spotting the holes in it. And the so-called experts they consult are frequently paid not by the media, but by drug companies. The mainstream media is dominated by government and drug company spokesmen and women. On radio and television, the spokesman or spokeswoman you hear advocating vaccines or some new wonder drug may well be receiving payments from a drug company. Even books published by mainstream publishers are sometimes suspect, published with the aid of advance orders coming from drug companies or the meat industry. There are even doctors who are paid to write letters to newspapers promoting or defending certain foodstuffs or drug therapies. I'm afraid the world of medicine has been corrupt for years. The coronavirus crime, which has now become the coronavirus crime for eternity has merely exacerbated the problem. I've no doubt that the coronavirus crime was created for specific reasons and that the pharmaceutical industry was involved in those reasons. Healthcare systems around the world have been taken over by an absurd obsession with a disease which is no more dangerous than the flu. Nothing could possibly have been as incompetently managed as the response to this infection. Millions of doctors and nurses have been convinced that we're fighting a war against a killer infection. But I suspect more and more of them are now feeling ashamed and embarrassed at what's happened. The people who stood on their doorsteps and clapped believed that they were applauding real heroism. And as I showed in my video on brainwashing, that's what the authorities wanted them to think. People have been raising money for NHS staff, unaware that many staff admit that they're working less than they've ever worked. Everyone was told that NHS staff were risking their lives, and every NHS employee who fell ill or tragically died was given massive publicity. It was part of the brainwashing exercise. The NHS in the UK employs well over 1 million people. It's sadly inevitable that some should die every day of the week, and every year many die of the ordinary flu. It's tragic. But this year those lives were used by the government as part of their brainwashing exercise. The scam shouldn't have been a surprise. Our government has conned us all. As I said a few minutes ago, we just have to remember Coleman's 8th law of medicine. Here it is. The medical establishment will always take decisions on health matters which benefit industry, government and the medical profession rather than patients, and the government will always take decisions on health matters which benefit the state rather than individual patients. What you read, hear or see about medicine and health matters will have more to do with the requirements of the pharmaceutical industry and the government than the genuine need of patients. I wrote that in 2006, but it's just as accurate today as it was then, perhaps even more accurate. Thank you for watching, and thank you for your support and encouragement. Please copy and share the videos on Twitter and on Facebook. And if you want to put on a translation, that's fine. If the videos disappear, please go to my website, www.vernoncoleman.com, to find out where you see them. The website isn't always easy to find, so just key it in. The transcripts of all my videos are always on my website. Thanks again for watching an old, battered man in a chair. I haven't authorized any ads and there's no sponsorship. If you want to see more videos from me, please subscribe to my channel because the videos aren't always easy to find. And let's spread the truth together. Thank you for watching.